vascular functions, maintain the body temperature, muscle strength, skin dryness, menstrual cycles. They also help to manage the body weight and in the clearance of cholesterol. So in ma'am's presentation really made me study and go in depth that how all these metabolisms are interlinked and interrelated. And once we have a low thyroid function, that is hypothyroidism, so we usually get to see these symptoms in our body, as thyroid damage caused by autoimmune diseases is the most common cause of hypothyroidism. So there is a low production of thyroid hormone leading to thinning of hair loss and slow heartbeat, poor appetite, constipation, and we can see many more symptoms on the slide. So next slide, please. As I begin now with my case study, there was a client, female, 35 years of age. Her height is 155 centimeters. Her weight is 80 kgs. BMI is 33.29, and that indicates that she is obese. So according to Broca's index, her ideal body weight is 50 kg. Her medical and dietary assessment shows that she is suffering from hypothyroidism since last 1 year. She's pre-diabetic. Her food preferences that she's a vegetarian. She is right now having classic symptoms of hypothyroidism. Hello.
We can hear you, Shweta.
I cannot see my slides. The connection is lost in the slide. I cannot see my slide.
Can you see it now?
No,
We
I
can
cannot.
see it. No, but we can see it. So I think there's something at your end only.
Quickly come. I cannot see the slide. They can see me, but yeah. Suddenly this page has come.
Just minimize the window.
Just give me a second. I was speaking, I was very well.
We can hear and we can see your slides. I think only at your end.
So can I speak from the saved slides then?
Yes.
Yeah,
you carry on. You open your presentation. I have this presentation, Shweta. I'll keep
coordinating. Yeah.
adjusting. Yeah. Yeah, we are on the health and dietary assessment slide. This is she has hypothyroidism since 1 year, pre-diabetes. Her other complaints are that's the slide.
Her other complaints are fatigue, weight loss. She's having constipation and general GI distress. And despite trying her level best, she's working out 3 days for yoga and 3 days of walk. She's unable to lose weight, and in the past 6 months, there is a weight gain of 3 to 5 kgs, we can see. And her biochemical parameters are also showing that she's a pre-diabetic and she's hypercholesterolemic, and her vitamin D levels are low, which are 12 nanograms per DL. Her B12 values are normal. So just give me a moment. I'm trying to open up my own slides.
Yes, please.
There is some connection lost between my slides and WebEx. It's saying add the video address to connect.
Okay, don't worry. Shweta, you can read the 24-hour diet recall slide from your own laptop. I'll keep changing from here.
Open my desktop, no? Yeah. Okay, I'm back. I can see my slides now.
Great. Okay. All right.
So now we have discussed her biochemical parameters, and her dietary assessment shows she's a vegetarian and she has a disciplined eating pattern. So after analyzing her biochemical parameters and her dietary recall, I have tried to give her a diet which is helpful for her as anti-inflammatory, low in gluten, rich in antioxidants, and anti-inflammatory, hypocholesterolemic, and hypoglycemic, so that she can lose weight. Since she's obese, we are giving her 25 kilocalories per day. So that will be multiplied by her ideal body weight. So we get 1,250 kilocalories per day, from which carbohydrates are 55%, that is 172 grams, protein is 22%, 69 grams, fat is 23%, 32 grams. So, next slide, please. Based on this, I have planned a meal for her. This is a day's menu on our screen now. On rising, I would advise her to take a glass of plain water with her thyroid medication. And after 1 hour, she can consume a herbal tea. Here I am giving a tulsi tea to her, which is rich in different minerals, and at the same time they have adaptogens, because they will help her to release her symptoms of stress. And two very important points are that when she's taking a herbal tea, it is devoid of caffeine. At the same time, there is no milk present in the tea. So this will help her to improve the thyroid medication she's taking in the morning. And after that, I assume she's going for her morning walk or she's doing the yoga. During the walk or the exercise, she can sip coconut water, because coconut water is rich in potassium. This will help to leach out the extra sodium, and in case she has water retention, this will help her to diminish it, and at the same time hydrate her very well. Now we continue with the breakfast. In breakfast, I'm giving her 2 sprouted moong dal chilas with coconut chutney and a glass of buttermilk. Moong is a very rich source of protein and it is hypoglycemic in nature. Sproutings are superfood. In a very interesting study, I read that when we sprout, it's behaving like a miracle food, because vitamin C, vitamin B is increasing tremendously, and it also inhibits the anti-nutrient compounds. Sprout foods are gut friendly because the enzymatic changes taken place in the carbohydrates in the sprouts, they stay in the gut for a longer period of time, and they give a steady release to glucose, and therefore they are friendly in, they increase the, they improve the absorption of the sugars in the body, so they are gut friendly and anti-inflammatory. Now buttermilk is just to add the satiety part. 30 grams of curd is used in this buttermilk, which will provide protein and improve the gut health. Vegetables are certainly very much important here, as they will add all the antioxidants and fiber. Now making this chila in 1 teaspoon of coconut oil, which is again having medium chain triglycerides. Assuming the inflammation levels are high and liver is not able to clear the cholesterol levels. By very interesting study I read that on the liver there are receptors situated, and these receptors, they work very well under the influence of the thyroid hormone. So when the hormones are low, T3, the active form, the clearance of the cholesterol is not taking place. So here MCTs provide very good support to the liver, and they help to digest it very well. Now at 11 a.m. when she's in the office, I would advise her and I would guide her to shift to from tea intake, which is usual I saw in her recall. I would advise her to take few nuts like walnuts and almonds. Walnuts are very rich in omega-3, and when they have melatonin, as they have the highest antioxidant capacity to quench the free radicals in the body and hence lower the inflammation. Almonds are rich in protein and vitamin E levels. So this will be a very good snack, and she's office goer. She can easily carry them in her office in her purse and consume it there. With that, if she also takes a small bowl of papaya or a guava, it will be a boon. So we proceed to the lunch now. Lunch, I'm giving her a small green salad with lemon dressing, a small yogurt bowl with nigar seeds, and a medium bowl of loki chana dal with 2 amaranth wheat rotis. Now, here we need to cut the gluten part, because gluten is, there are studies also, and ma'am had explained us very well that it can have some inflammation reactions in the body. We need to cut down on that. So we will advise her to first slowly, add some amount of wheat to it, and gradually she can learn to make good rotis without the wheat also. When you use a warm water while making the dough, they come out very good. So amaranth roti is gluten free, and it will give good amount of minerals and other nutrients, fiber, and they will slowly absorbed in the body. Now dal is a rich source in again fiber and proteins. Lauki I have used because it is low in calories. Initially I wanted to give her a spinach, but then I thought Lauki is a better option because it will add the bulk to the meal and she will feel full. Here I would advise her to consume a yogurt which is rich in probiotics, as she has a GI distress, so that will heal her gut. And now we are shifting to the evening. Next slide, please. Yeah. So after lunch, she can, in around 4:30 p.m., when again she is used to having her tea, I would advise her she can go on with her normal tea. But if she chooses a caffeine-free tea, which is rich in flavonoids, that will be heart-friendly and better for her. Late evening, again, she has to make use of these amazing superfoods like trail mix. So here I have personally combined the trail mix like cranberries with pumpkin seeds, sunflower seeds, flax seeds. They are easy to have, they give lot of satiety, they are very good source of iodine, selenium, fiber, protein, and moreover, the importance of eating these small mid-evening and mid-morning snacks is that they keep you satiated and you don't tend to overeat for your final meals. So dinner, definitely she is to lose not much weight, so I have taken care to add a soup and a salad in her dinner, which is I'm giving her a medium bowl of lentil soup with a medium bowl of paneer and vegetable salad with some lemon dressing. She can also be trained to make a hung curd dressing, and some sprouted fenugreek seeds would definitely do the wonders because they are really hypoglycemic in nature, and that will prevent her pre-diabetic, that will try to improve her pre-diabetic status. And bedtime, if her appetite permits her, she can also take a very small cup of milk, like 100 ml, like a shot of haldi and curcumin. We know very well that how pepperin present in peppermint, and it taken when it is combined with the curcumin present in haldi, improves the absorbency of the curcumin 200 times, 2000 times more. So that will be a very good boosting and immunity boosting drink. Next slide, please. Now, this is the chart where you all can clearly see the macronutrient distribution. Ma'am had told us to take care of the selenium, iodine, zinc, vitamin C. So all those I found very easily. Iodine I was searching, and luckily I came to know a study done by NIN, ICMR. They have made a very systematic database of Indian foods which are rich in iodine. So in my next slide, I'm going to show you that also. Uh, so here there is a macro distribution, micro distribution, and the total calories this diet is providing is, next slide please, 1311, with the carbohydrate content 163 grams, with protein 54.6 grams, fat is 38.86 grams, and all the micronutrients are also taken care of. I have advised her here to use 1 teaspoon of iodized salt, since I've taken care of the vegetarian sources which are iodine rich, so that would suffice her iodine requirements. And vitamin D supplementation is needed now, so I'm going to advise her and suggest her to take the help of the endocrinologist and take a supplement since the levels are really low. And she's sitting in the office because she's an IT worker, so she's not getting a lot of sunlight, I presume. So vitamin D supplementation for 3 months will surely help her to improve her clinical conditions. Thank you. Next slide, please. These are the superfoods we have used in this meal plan, including the herbal teas, sprouts in moong sprout or fenugreek seeds, our walnuts, almonds, seeds like pumpkin, flax seeds, and green teas, turmeric, black pepper, which all the in totality will definitely boost her immunity and micronutrient status. Next slide, please. Ma'am had very well explained us. Again, I was very happy when I went through the studies which showed me that how selenium, what is the role of selenium in supporting the thyroid health. So the vegetarian sources I have given her, since she's our vegetarian patient: lentils, green grams, Bengal gram, peas, cashews, our nigger seeds, that is kalonji, garden cress seeds, that is halim. So all these vegetarian sources along with some non-veg sources will give a good selenium-rich diet. We can also clearly see the food sources mentioned for iodine, zinc, and vitamin C respectively. Next slide, please. A very beautiful study clearly stated that 10 gram consumption of fenugreek seeds per day, and that too in a pre-diabetic subject, really helped to lower the conversion from pre-diabetic to diabetic status. And at the same time, this is maybe true because of the decreased insulin resistance found in the subjects. This was the result. And another interesting study showed the importance of selenium. Here they had, we all know that in the liver, T4 is converted into active form of T3. Now their selenium role is very important in conversion. And study showed that when selenium administration was done in both autoimmune thyroiditis, Hashimoto's, and mild grave disease, there was clinical score which improved in the well-being of the patient, and it also reduced the TPO antibody titers. So this supports that selenium is definitely important. And with a quick glance at the dietary guidelines, use at least 5 portions of variety of fruits and vegetables. A rainbow diet, as we know that how important it is in providing the phytonutrients and important different antioxidants in the diet, and avoiding adding extra sugar, especially the refined foods like biscuits, noodles, white breads, naans. So, guiding the patient to make the own individualized home-based snacks in the form of healthy cutlets made with chana, then chickpeas, a vegetable bowl with hummus, or like sprout salad, chickpea salad, then even sattu, which is very famous in Punjab here, and I have tried giving it to my patients in my small practice of 2 years. It helps a lot when people feel energized after taking a sattu, which is made from chana flour. So we have to take care of giving them good choices. And these patients are a little bit stressed. So I've seen they try to follow the extremes by taking smoothie diets and fat diets. So we have to counsel them that how by eating right but not eating less will really help them to lose the weight and gain their health back. And one very important thing that when you start taking the thyroid medicine, so we have to explain it to the patient, then you are at the same level of as a normal physiologically individual, because now you are getting supported with that hormone. So there is no excuse that the metabolism is moving slow. So we have to counsel them that now you are at par at other individuals with the proper balance of dietary guidelines and the exercise. You will be slowly reducing the weight and gaining health. Next slide, please. Iodine is very essential for the synthesis of thyroid hormones, which in turn is responsible for normal physical and mental growth. Now, this is the pie chart which I have taken from V. Sri Lakshmi's book. It gives us cereals, milk and milk products, and flesh foods and pulses. How they are, the percentages of each is visible here. Few points I've taken from Geeta ma'am's previous session slide, where it is showing us the importance of and requirement of the normal daily dietary intake of iodine by an adult, which is needed is 100 to 150 micrograms. Now, iodine when ingested in large amounts is excreted. So people with autoimmune thyroid diseases may be sensitive to harmful side effects from iodine. Taking iodine drops or googling and taking the kelp supplements or seaweed supplements will not solve the problem. It may cause or worsen the hypo or hyperthyroidism. So they have to be cautioned and warned for this. Next slide, please.
Oh.
Goitrogens may worsen thyroid function. Goitrogens are compounds that interfere with the normal function of the thyroid gland.
Now we can wind up a little fast.
Yeah. So the goitrogens have to be avoided. In my next slide, you can clearly show, please. Now, these are the cruciferous vegetables, the certain fruits and starchy plants, and soya-based foods which have goitrogenic, which may hinder the absorption of the working of the thyroid hormone. So when we cook them or when we steam them, then these foods can be used in moderation by a patient who is on a hypothyroid medication. Next slide, please. Mostly it is seen that gut imbalance is present in thyroid patients because they have a weakened gut and their immunity is low. So what happens is that this allows the toxins and microbes and they provoke an immune response. The body makes certain antibodies which start attacking the own thyroid gland itself, and therefore the hypothyroidism occurs. So this can be reduced by taking care of providing a gluten-free diet and taking good probiotics and healthy fiber-rich foods like vegetables and fruit-rich diet, a diet which is rich in omega-3 and antioxidants, so that the leaky gut is corrected. Next slide, please. Certain, again, lot many patients in practical aspects are seen to take multivitamin supplements, including calcium, iron, and they are so used to having their coffee early morning, a lot of caffeine, lot of tea, then chromium picolinate, which is a cholesterol lowering drug. So sometimes even biotin supplements, which they induce they're taking all these supplements along with the thyroid medication, and the gap is very less, then they might interfere with the absorption of the medication. So all the dietitians should confirm that patients are at least maintaining a gap of 8 hours so that the absorption of the medication is at its best. Next slide, please.
Yeah, it's there, Shweta. Okay. So the next slide is for activities of daily living, and she's given the. Can you see the slides, Shweta?
Okay, I cannot see it. I just explain in a very short.
Yeah, please wind up in the next 1 minute.
Yeah. We know that the importance of the exercise is last but not the least. It is very important. It improves the metabolic rate, which we are for in these patients. They improve the
Your voice is breaking. You can switch off the video.
Where we saw the yoga by the patients and Jai Pranayam were done with the patients. They really had excellent effects on the index, management, and pH hormone reduced, and statistically significant amount of triiodothyroid was improved. So this reveals that yoga has a significant role in improving, and moreover, exercise also reduces digestion part. Take home messages. Eating is very, very effective in parts of from endocrine consumption. If the patients are adhering the right guidance, can have a certain win-win situation and this program.
Thank you, Shweta.
Thank you, Shweta, for that excellent presentation. Salome ma'am, Dr. Geeta, any comments?
I think we are running late, Dr.
Yeah.
Geeta.
So just to give two-liner for this, fantastically,
Yes.
the concept well understood. What is important is the antioxidant, anti-inflammatory approach. So congratulations, Shweta. It was a wonderful presentation. And if Salome ma'am has to give a final line, she's welcome. Ma'am, over to you.
Thank you, Geeta. I think she has done it well. So it is the perspective of each one, how you go about giving counseling. But all the principles required, she has included very well. So congratulations. Yeah, according to me, you could have reduced the number of meals to reduce the insulin resistance as per the current evidence. I do not know the medication of the patients, but that is how we do it. Thank you, Sweta, once again.
Thank you so much. Great presentation. Over to you, Zankana.
Yes, Zankana.
Thank you, Salome ma'am, for this something different topic, diabetes, food and nutrition. Okay, next slide. Okay. The epidemiology, diabetic foot has become the one of the most common and serious, but again, it's preventable complication of diabetes, and it's frequent cause of hospitalization and the disability. Every 30 seconds, one leg is lost or amputated just because of diabetes somewhere in the world, just because of we are not giving proper education, and mainly because of uncontrolled sugar. And the third biggest factor for food infection is the smoking. We have seen in our patients, those who are smoking, there's almost 30% chances of getting diabetic foot infection than the normal people. So diabetic foot problem include like corn, calluses. The problem start with the corn, calluses, and the non-healing foot ulcer, and then last stage is the amputation or gangrene and the amputation. Next. The risk factor for developing diabetic foot. First, most important is the long-standing diabetes, uncontrolled diabetes for longer duration of time, neuropathy. It may be because of long-standing diabetes or other cause, but neuropathy in the feet, wrong footwear. Because of wrong footwear, many patients get frequent corn, calluses, and the flat feet. Because of that, they get diabetic foot infections. And the low immunity because of poor diet. These are the main risk factor for developing diabetes foot. There are another risk factor which is like because of neuropathy, they will have some problems. Like the neuropathy means PVD, peripheral vascular disease. Okay, history of proper. Next slides. And because of neuropathy, they have very common, this is LJM, limited joint mobility. Because of that, the small thing, if something is there, they will immediately, if sugars are high, the infection is there. So we have to be very careful if patient has a neuropathy. In fact, in an OPD only, last month, we have one patient, he went to temple after the counseling, but he didn't listen, and with the bare food, and चावल का एक दाना चला गया था, only चावल का एक दाना उसके पैर में चला गया था, and he didn't realize for almost 1 month, and then after 1 month he came up with the foot ulcer and swelling, and then we diagnosed with diabetic foot, and just because of one rice dana.
Great.
This is a pathophysiology of diabetic foot. So the problems start with the uncontrolled high blood sugar level. This will cause the damaged nerves and blood vessel. Slowly it will reduce the blood flow to the feet, because feet is the largest organ of the body. So the blood flow will reduce, it will damage nerves and blood vessel, and the problems start with the numbness, tingling sensation, loss of sensation, and then diabetes neuropathy. And then this will cause the problem like corn, calluses, and other problem. The problems start with this. Next slide. So, is there any role of nutrition in diabetic foot? Yes, we are the power of nutrition. We should not ignore the power of nutrition. As a nutritionist, as a dietitian, we are in all the diseases like clinical nutrition, metabolic disease, nutrition deficiency, autoimmune disease, pre and post surgery, GI and renal disorder. Same way, the nutritionist or dietitian play very important role in diabetic foot. Not directly, but indirectly, yes. And it's a joining hands. So not only dietitian, but we need the clinician support also. Next. So is any role of nutrition in diabetic foot? Yes. Nutrition is a critical component of healing of diabetic foot ulcer. There is a definitely nutritional elements of diabetes foot care. So what you eat have a significant impact on overall foot health as well as the ability to heal and prevent the foot ulcer. If any patients with the poor diet, it will cause the malnutrition. In fact, in diabetic foot, we have seen many patients with the diabetic foot, they have a very poor dietary recall. And hardly they eat any, the calories, protein-rich fruits and vegetables. So this poor diet will cause the malnutrition, the poor glycemic control. It will further reduce the immunity to fight with the infection. And because of low immunity, they have a poor wound healing. So nutrition is often neglected by the clinicians for the diabetic foot. So they only manage diabetic foot, but after a case, 2-3 case, now they realize the importance of diet also. So nowadays, if any patient wound is not healing, immediately the doctor will send, पहले डाइट ठीक करके आओ. डाइट ठीक होगा तो आपका वुंड जल्दी हील होगा. नेक्स्ट स्लाइड. So nutrition is connect very fast healing of the wound. It will improve your immune system and it will improve the glycemic control. Not only it is important for the wound healing in diabetic patient, as well as for the sugar control and the weight management. So next slide. Previous slide. Yes. So as you can see, patients with diabetic foot ulcer, small, it's like corn, and they have a standard medical care. It will increase in IL-6. That means increase the white blood cell count. And it will lead to the poor wound healing. At the same time, with the standard medical care, if we give proper nutrition, it will decrease in IL-6 and it will help in faster healing of that wound. Next. So it's diabetic foot. The nutrition is important. So we need to manage with the proper carbohydrate, fats, especially omega-3 fatty acids, vitamin, the antioxidants like A, B, C, D, E, proteins and amino acids, especially arginine, glutamine, and methionine, leucine. The minerals, copper, zinc, iron, and the functional food will help the proper healing of the food. With this wide range of micronutrients and food supplements and combined are helpful in the wound repair. Next. Studying are showing it is not like different diet for diabetic foot. We have to follow the healthy guidelines what we refer for the type 2 diabetic patients for the reducing glycemic control. So same thing with the low carbs, high protein diet, good amount of fiber, and if sugars are controlled, definitely it will help for the faster recovery of the diabetic wound. But still there are many studies showing that the amino acids like arginine, glutamine, they are non-essential amino acids. It will produce in our body, but still we require that with the higher amount for the faster wound healing. And the leucine called beta methyl butyrate, that is HMB, which will help produce the new tissue and slowing the muscles breakdown, enhancing the protein synthesis. So what are the arginine rich foods like meat, fish, nuts, pumpkin seeds, legumes, and all the dairy products? Same glutamine-rich foods like milk, chicken, seafood, shellfish, tofu, and especially for the HMB, they use the studies are saying grapefruit, alfalfa, and the catfish. Okay? But what we have seen in our practice, research are saying this important nutrients are good for the wound healing. Diabetic foot. Next. Okay. Probiotic, definitely it will help. There are 6 to 8 studies report the positive effect of probiotic supplementation on healing of the diabetic foot. So all the start from the gut. If your gut is good, definitely everything is good. So we need to give the good amount of probiotic, and it will not only help for the faster recovery of the wound, but at the same time it will also help to reduce the cholesterol level, decrease the HbA1c level. Okay. Next, the minerals, zinc, copper, selenium, definitely it will help in the wound healing. But what my take is that it's all healthy guideline. So if patients, research are saying you need to give this, but there are many studies. They are saying that no need to give above the RDA level. So whatever you're getting from the food according to RDA, it's enough. No need to give any extra supplements. If you find any deficiency, yes, your doctor will suggest especially B complex and the multivitamin supplementation. Zinc also deficiency affects the phases of wound healing. So there are patients we require the higher zinc amount if dietary intake of zinc is very low, then only we suggest the supplement. Otherwise, everything you get from the diet. So try to improve the nutritional status with the diet with good amount of nuts, pulses, and the seeds. Next, albumin. We have seen in our patients the serum albumin level appears to be reflect inflammations, wound healing, and disease severity. So serum albumin level can be considered as one of the best predictor of the wound related complications. For this presentation, I have talked to many 3-4 surgeons regarding their take on serum albumin level. So they found that in all the diabetic patients, if they have a diabetic foot, they have low albumin level. So if we improve the albumin level, it will help in a good recovery, a good healing of the wound. Next. So medical nutrition therapy will be important role. Next. So this is a case of non-healing diabetic foot to heal foot. The first picture is like this is known person known to me. So if their wound is not healing after a 1 month, 2 months of continuous medical care with a good amount of dressing and antibiotic, and still sugars are very high, so they send it to endocrinologist. So we control their sugar with the proper insulin management, and we give the proper food care guidelines, and then we improve because on dietary recall intake is very poor. So we improve the nutritional status with proper diet, low carb, high protein diet, and we found out the low albumin level. So as a patient is non-vegetarian and he is not eating any type of food, so we have to give supplements. So we have to give the albumin supplements, and you can see that a non-healing wound, almost 1 month of care, medical care, but still it is not healed. So after that, with the proper nutrition and proper food care guidelines and proper insulin management, you can see the 3 months wound is properly healed. We have to give a proper the different kinds of footwear, non-bearing footwear to this patient so the pressure will be less on that wound. So low albumin level is, I think, strong predictor of non-healing diabetic foot. Next. The same way, this patient's non-healing wounds, almost 3 months, it is not healing, it is healed. Again, it will have some pus or fungus infection. So same way we treated with the proper diet, low carbs, high protein diet. His the albumin level was okay, but we have to give the high protein diet, good amount of fiber and the probiotic. And you can see that after almost 3 to 4 months, wound is completely healed. Next. This is all about the after you getting diabetic foot, but just to prevent the diabetic foot infection. So if you are a dietitian or diabetes educator, just spare at least 1 minute of your time when you consult your patients and see what type of footwear they are wearing. If you find something different, some redness or some fungal infection, some corn, just advise them to go to a doctor or a diabetes educator, so they will counsel you. So this patient because of old age, he is not able to cut his nail. So so after almost 6 months or 1 year, he didn't cut his feet nail. So because of that, it totally fungal. I mean, it's all nails has fungal infection in all the nails. So when he come to OPD, we cut his nail. So that is prevention. So otherwise, after 6 months, definitely he will have some fungal infection and some corn or callus and some diabetic foot. Same way, this patient come with the corn, and she is using corn care for almost 6 months. But because of uncontrolled sugar, because of weight, it is not that ulcer or that corn is not healing. So we shave that corn and we advise the proper foot care education. So at least we can prevent the diabetic foot. Next. So diabetes food education program should be implemented to create awareness regarding prevention as well as the management of diabetic food. This is general guidelines of diabetic food to prevent diabetic foods. So in people with diabetes should not, they should not wear a chappal or slipper. Nothing should be in between the fingers. Directly, your feet should go inside with the back support. Never use hot water, and always after a bathing, because this is very common in old age people and obesity. After a bathing, they will not dry their feet. So make sure you dry completely your feet, especially in between the fingers. Inspect your feet daily or alternately with the see any warning signs of swelling, some corn or some calluses. And always whenever you are wearing shoes or any type of sandal, make sure you see inside if any stone is there or any septic pin is there. And always use socks, सीमलेस सॉक्स. जो इलास्टिक होता है ना, वो वाला सॉक्स नहीं, सीमलेस सॉक्स पहनना है. एंड यू कैन यूज द ओल्ड सॉक्स कॉटन. एंड नेवर ट्रिम योर नेल्स. कॉर्नर से कट नहीं करना है. ऑलवेज बी ऑन अ वर्टिकल. नेक्स्ट. So it all works together. Only the medical nutrition therapy, definitely foot care management and educations, proper footwear, and your medical the consultant proper advice. So for preventing diabetic foot, definitely patient educations, the foot care, protective footwear is important. At the same time, nutrition is also important. If you have a good amount of proper nutrition, it will help you to increase your immunity level, and definitely chances of getting diabetic foot is less if your immunity is high. If immunity is low, you will immediately catch infection, and you will have the slow process of wound healing. Next. Next. So thank you.